What's going on, everybody? Dr. Thompson here with Exemplify Health Center, your Wellness Way affiliate right here in Yorkville, Illinois. Happy Saturday. Thank you guys for joining us. If you are joining us, please say hello and let us know what you're doing today and where you're watching from. And if you're watching the replay, just go ahead and put replay. And also let us know where you're watching from as well. I always love to see where everyone is watching from all over the country. So guys, today is going to be really interesting because I'm going to go over with you guys common skin conditions that are not normal. So just remember, guys, there's a difference between common and there's a difference between normal. So just because a lot of people might be suffering from it never ever means that it's going to be normal. And what's interesting is that you will see that some of the things that you're going to see on the skin are actually a reflection of really what's happening internally inside of the body. So a lot of these things you may go to a dermatologist for and want help with it. And many times, guys, really the only thing that a dermatologist is going to do is either refer you to someone who is to a doctor who is going to say, yeah, here's the reason why this is happening, or they're going to give you something on the skin that is going to either burn something off or lower in or just basically block inflammation. So remember, guys, you always want to get to the reason why it's happening in the first time, and many times the skin can be an unbelievable reflection of really what is happening inside of the body. So again, guys, just because something is common doesn't necessarily mean it's normal. When you look at, how many people today die of heart disease and die of cancer, for example, or the number of people who have autoimmunity, or the number of women or couples who are having problems conceiving, or the number of women who are having problems with their menstrual cycle, or the number of people who are having problems with type 2 diabetes, insulin resistance, weight loss resistance. Guys, just the fact that so many people are actually suffering from it, we would never say, you know what, we're just supposed to have it, so I guess I'm not going to do anything about it. But what we're doing a horrible job of doing when it comes to healthcare is we're doing a horrible job connecting the dots and actually figuring out what this means and to fix causes and to stop covering up symptoms. And guys, some of the things I'm going to talk about are actually things that even I have suffered with, growing up, and no one ever connected the dots and made the connection with all of those. So let's go over these common skin conditions that are not normal. And I will actually tell you is that I've seen all of these improve without drugs, without surgery, because we know how to get to the underlying reason as far as what it is happening, okay? So common skin conditions that are just not normal. So we got to stop saying just because it's common, it's actually normal. So here are some of the things that I'm going to go over with you guys today. Guys, this is for men. This is for women as well. So if your husband is not watching, you might want to grab them and prepare to look at their ankles, all right? So here's what I'm going to go over because I see this clinically all the time. So number one, bumps on the back of the arm. So by the back of the arm, I mean back here. How about rosacea, which is inflammation around the nose and around the cheeks? How about hair loss on the ankles? Women, you're probably not going to notice this if you're shaving your legs, hopefully. How about toenail fungus? How about dark circles around the base of the neck? And then how about age spots? By age spots, where you're going to see these is going to be actually around the face, around the forehead, and especially on the backs of the hands. And then finally, I'm going to talk about the granny hump, all right? You know the granny hump. I always see these commercials about, exercisers or creams or things like that to help with saggy jowls. And I'm going to show you why you get that, because it's really mostly a postural issue. But if you are getting that swelling or that hump on the back, I'm going to show you the two biggest reasons why that actually could be happening, okay? So here's the first thing that I want to talk about is I want to talk about those bumps that you see on the backs of the arms, okay? Basically what this is this is an increase in keratin on the skin that causes thickening of the skin, and they look like clear bumps, or they look like pimples, okay? Now, you will see this a lot. You will see it a lot. You'll also see it a lot in people who are very systemically inflamed, But this is not a skin issue as much as it's a reaction to something happening in the gastrointestinal system. So here's what this one is called, these small bumps. So look at the back of your arms. Go especially to your kids and look at the backs of their arms as well. And the number one reason that is actually causing this is going to be wheat gluten, okay? It's going to be wheat gluten. Now you understand why we test food allergies in so many people. Now, technically, it could actually be any food allergy, but guys, by far and away, the most damaging, most inflammatory food, one of them especially, is going to be wheat gluten, okay? So guys, when you start removing foods that you are having an immune response to, you will see an unbelievable change in your skin as long as you are avoiding it and as long as you are doing the things necessary to help repair and heal the gastrointestinal system, starting off with the barriers. So that is actually wheat gluten. And guys, there secondarily could also be some things with omega-3 fatty acid deficiency and things like that, and sometimes both. But my goodness, guys, you know how many people have said, gosh, I got rid of wheat gluten and those bumps actually went away, okay? So the first one is actually wheat gluten. Now, why is wheat gluten, why can it be so bad and so damaging? Well, one of the reasons why is because the actual gluten protein, especially a substructure of it, what it actually does is it actually signals what are known as the gap junctions in the gastrointestinal system lining to actually open up. And so it causes it to say, hey, open up the drawbridge and let a bunch of stuff through. So it really can be one of the first things that can cause so many gastrointestinal issues. And one of the reasons why is we start introducing grains that contain gliadin. We contain other grains like wheat gluten, and we start giving it to babies when they're 3, 4, 5, 6, 7 months of age, who actually already have a wide open gut, and it needs to be so that mom can pass on very large protein structures directly through the gastrointestinal system, like antibodies, to pass on immune system, part of the immune system, and big cells, white blood cells, things like that. So it has to be able to go through. So then you start introducing food, and you wonder why your child's skin starts to change, starts to get very red cheeks, starts to get bumps on the back of the arms, or maybe breaks out in eczema. And this is one of the reasons why. So we have an early exposure to it, but what is a staple in the standard American diet is, in fact, it's wheat. So it's bread, it's pasta, it's all of those things that contain the protein gluten. Now, here's the thing. You don't need bread. You don't need grains in order to survive. You don't need it. And in fact, really what's attached to this gluten is so many simple refined carbohydrates. Now you're also going to have some big time issues when it comes to your blood sugars, your insulin, eventually leading to insulin sensitivity, and eventually leading to problems with cortisol and problems with blood sugar control and blood sugar regulation. And then you're going to be running into some more problems as well. So wheat gluten is actually going to be the first one. Second one I want to go over is rosacea. Okay, this is something as well that we see improve clinically all the time, but we don't give anything, put anything on the skin. So you guys, understand, as someone suffers with acne, or someone is suffering with rosacea, which you get tons of inflammation on the cheeks, it can start to actually get inflamed, it can scab, it can peel. Rosacea is not a problem with not having enough vitamin C serum on your skin. It's not a problem of having enough retinol on your skin. It's not, it's not because you haven't put enough, concealer on the skin, or some kind of caffeine type stimulant, to reduce lines and wrinkles. But the problem is, the first thing when we start seeing this is we think, oh, maybe I just need to put something on my skin. It has nothing to do with it. So what is one of the biggest things? What is one of the biggest causes of rosacea? Okay, so you guys remember, anything that's happening on the skin is really something that's happening systemically. And yes, you can put some things on the skin, and yes, you can see a temporary improvement, but if you never change the physiology that caused it in the first place, all you're going to be doing is you are going to be spending a lot of money at Target, a lot of money at Walmart, at Walgreens, or at Ulta, trying to find the latest and greatest and fanciest cream to try to bring this down. So many times you go to dermatologists for it, they're actually going to put some kind of immunosuppressant or some kind of steroid cream, and yes, that will actually take down the inflammation, but again, it's never getting to the reason why you're having that inflammation, that inflammatory response. So you know how many women that we actually see this, who are suffering with rosacea. So they come in and they have a lot of the same types of symptoms. They'll be very puffy in the face. They'll have a lot of water retention. They'll have a lot of gastrointestinal issues. They'll have a lot of red skin. So here is one of the biggest things that I have seen is that rosacea actually describes it, but what is actually one of the biggest causes and one of the biggest factors, and it's this. It's autoimmunity, okay? It is autoimmunity. Guys, when we see rosacea, the first thing that I'm saying is, all right, I think there is some kind of autoimmune reaction that is taking place. And this is actually one of the things that started to pop up even with my wife, who was suffering terrible, terrible problems with Hashimoto's. She actually had autoimmune antibodies to her stomach parietal cells, which are making stomach acid. She also had autoimmunity related to what's known as scleroderma, or to collagen, okay? Collagen, which is actually in your skin. And so she was having actually 4 different autoimmune reactions taking place. And guys, I'm going to tell you, autoimmunity is much more common than what we actually think it is. Because right now, they have actually defined and have the ability to be able to diagnose over 100 different autoimmune reactions in the body right now, and they're discovering more every single day. This is why if we need to get a quick autoimmune panel on someone, we can do a blood test, and then immediately what we see is, we'll see, gosh, there's 4 or 5 different autoimmune reactions to the top 30 autoimmune diseases that are the most prevalent in the United States. And many times people don't have 1 or 2, they have multiple different autoimmune reactions taking place. So guys, I want you guys to understand, autoimmunity is not the body attacking itself. Let me say that again. It is not the body attacking itself. So you will read this all the time on the internet, in which the immune system is attacking its own tissues. Your body is not programmed to attack its own tissues. Just so you know that. Genetically, the body will not attack its own tissues. It's not designed for that. It's not built for that. And it's no different than if you go outside, you run, and you fall off a curb, and you sprain your ankle, and that ankle gets red, swollen, and hot. You wouldn't say, I have an autoimmune reaction taking place in my ankle. Technically, if the body is attacking itself, then you could call an ankle sprain autoimmunity. You could call, the body attacking itself. You could call heart disease the body attacking itself, because when it's trying to clean out damaged tissue, you will have things like scarring or plaquing and things like that take place during the repair process. Body's never going to attack itself. So what in fact is actually happening? The body is actually inflamed, and it's trying to clean out damaged tissue. So if you can actually discover, gosh, what on earth is causing the sources of the inflammation, then yes, the actual skin will start to clear up, if that makes sense. So we can see this clinically happen all the time. We start lowering inflammation, people say, oh gosh, rosacea is actually starting to go away. Or, man, I lost 10 or 15 pounds, and I'm not having bloating, I'm not having swelling, I'm not having those things take place. And the reason why is the only reason is because we're starting to lower inflammation. So guys, the rosacea can be a sign of autoimmune illness taking place, and it's very common when we're seeing it with some kind of autoimmunity with the thyroid, when we're seeing it with scleroderma, when we're seeing it with rheumatoid arthritis, especially the things that are involving the soft tissues as well. All right, guys, third thing, grab your men, because we're going to talk about losing hair on the ankles. All right, let me just put this out there. Guys, this has nothing to do with you wearing socks, okay? This has nothing to do with you wearing socks, okay? Because reality is then I always ask the question, so it takes about 40 years of wearing socks to finally lose the hair on your ankles? it doesn't make a whole lot of sense. So if, and this probably can happen in women as well, but you just don't notice it because you might be shaving your legs. But if you look at a guy and you tell your husband, hey, take off your socks, let's check something out. And if they have lost the hair on their ankles, and it usually will go up to like the bottom of the calf, sometimes it continues to go higher, then there is a problem. There is a problem going on. In fact, I've actually had younger guys reach out to me and say, I just all of a sudden lost all the hair on my ankles. So if it truly was the socks, then why wouldn't every man lose the hair on the ankles? And why wouldn't they all lose it at the same time? But sometimes they're losing it at 25 years of age. Sometimes others are never losing it. Sometimes people are losing it at 50 or 55 years of age. And here is the biggest issue. The biggest issue is high DHT, dihydrotestosterone, okay? Now, one of the things, if it continues, that you will see is you will also see that a man will continue to lose more and more body hair. So you might have a man who had, a ton of body hair, had a bunch of hair on the back. Now it doesn't grow anymore. So what is the reason why? Well, it's high DHT, dihydrotestosterone. And what dihydrotestosterone is that it is actually first created as testosterone, and then specific enzymes will convert it into DHT. Now, the thing with DHT is that it's about 10 times more potent a form of testosterone than actually testosterone in and of itself. So what you have is you have actually receptors for DHT, and those receptors are actually like hair follicles have receptors for DHT. So when you actually get it in high amounts, then what happens is that DHT will actually cause the hair follicle to thin, or the hair to thin, and the follicle to eventually die. So where you have these DHT receptors are in hair follicles, and you also will see why a man can bald a lot quicker. So they're losing hair on their ankles, and then they're losing hair on the top of their head, then at an accelerated rate, then yes, they are going to be very high in DHT, dihydrotestosterone. Now, you want to figure out why this is happening, because I know that people say, yeah, all you got to do is take some saw palmetto and things will be great. And yes, that can manipulate that a little bit. But one of the biggest reasons is like anybody can live, guys. You can live without hair on your legs, all right? You can live if you're bald. You can do that. But one of the things that you can't live with when you have high DHT is actually when it comes to prostate swelling, okay? Now remember, DHT is an androgen. So is estradiol. It's an androgen, which means it's tissue building. So if you have high DHT, and yes, you have receptors for it on the actual prostate, is that this will cause the prostate to grow or the prostate to swell. So it goes hand in hand that if you see a man losing hair on the ankles, that I'm going to guarantee you that he either already has the overt symptoms of having prostate swelling or they are well on their way. So if a man has high DHT, the prostate's going to grow, the prostate's going to swell, and so some of the issues that they're going to start running into is they're going to start to running into increased prostate size, which means it's going to push on the bladder, and again, the urethra runs through the prostate, so as it swells, it's going to pinch off on the urethra. So this is why men are going to frequently urinate. They might have an extreme urgency to urinate, especially if they're like, oh my gosh, I got to go to the bathroom, I can't wait. Or they have problems starting their stream of urine or even stopping their stream of urine, or they literally are like, going to the bathroom for a minute and a half and it's just dribbling out. So this is why, guys, if a man has high DHT, they're going to run into so many other problems. And again, guys, just remember is that if you are growing tissue at a high amount, what do you actually call that? You will call that down the road cancer. So remember, there are hormonal-based cancers because those specific hormones will quickly grow tissue, and then on top of that, you start to get very low immune system function that can't handle the cancer cell formation. So Your guy, if he's losing hair on his ankles, you need to do something about it. Now, can you take saw palmetto? Of course you can. But remember this. This is why I'm always very, very leery of giving a man some kind of specific herb or something, or giving them some kind of exogenous hormone. That's why this can be absolutely terrible without first knowing how those hormones are actually converting. So how do you know? Well, you can do a Dutch test, you can do a blood test too, and look at that and see what those hormone levels are, because you want to fix the reason why it's happening. And guys, for men, the number one issue, by far and away, the number one issue that can cause that conversion of testosterone into DHT is going to be a high insulin environment. A high insulin environment. And what causes a high insulin environment in a man? Too much sugar, too much grains, sorry, I just got a call right now. Not enough muscle mass, and just not enough activity, and just too much chronic mental stress, especially. So you got to fix the reason why that's happening. And this is, again, why so many men are having problems with testosterone. And then they go to their GNC and they're just like, well, I'm going to take some zinc. I'm going to take some stinging nettle leaf. I'm going to take some tribulus. I'm going to take some passion flower. And all of those in their special way are really, what they're doing is helping with conversions or blocking specific conversions. And so, men are like, yeah, I'm taking things naturally for it. But guys, nothing is going to be more powerful than what your lifestyle is. And in fact, dumping those things in the body without knowing the pathways can actually make things worse, right? Let me say that again. It can make things worse. So, and in fact, a lot of times too, we'll measure a man's adrenal function. We see that this is going on. Many times they'll have very low adrenal function. You'll see that they have very low DHEA, which is basically one of the foundational hormones that testosterone is created from. But again, if those pathways are off, you can give a man a bunch of DHEA, and you will see it goes down really bad pathways. And in fact, they can start growing breasts when they are doing it, okay? So this is why you want to actually fix the pathways versus dumping a bunch of herbs and supplements into the body. Those will help if the lifestyle is actually matching up to it, okay? Here's the next thing. Toenail fungus, all right? Toenail fungus. That just looks gross, all right? I'm sorry. All right, so here's the thing with toenail fungus, all right? Well, I lost a toenail, Dr. Nate, and it grew back with a fungus. Well, I've lost a toenail before, and in fact, this usually does happen when people lose a toenail. I've actually lost a toenail a couple of times. The first time I opened a door barefoot when I was about 14 years of age, and the door with my foot there, and the door actually peeled off the toenail. It was one of the most painful things I ever did. So I had to have the toenail removed, but it grew back. It grew back, it grew normal without any kind of fungus. The other time I dropped about 45 pounds from about 5 feet up on my toe, and it absolutely destroyed the nail. And in fact, I had to actually go in and drill the nail bed in order to release all the pressure from it. So getting a nail ripped off absolutely is just, it is so painful. But let's say that that happened. In fact, you don't necessarily have to lose a nail in order for a toenail fungus to actually grow. So what on earth will cause a toenail fungus? Because remember, guys, on the skin, you have things like fungus. You have growing on the skin. You have things like staph. Growing on the skin, you literally have billions of bacteria that are living on the skin. This is why having the healthy skin, having a very low amount of inflammation taking place, will help the skin to become a very healthy barrier. Now, it just so happens if you lose the nail, then you do kind of lose a barrier for it, but it doesn't necessarily mean that you have to have a fungus that grows. So you can actually get fungus anywhere. It can actually grow in the form of athlete's foot. It can grow in the form of jock itch. It can grow in the form of ringworm, like behind the ears. You can get a fungal infection on the skin anywhere. And a lot of it is just because you have a better environment for that to grow. So the skin starts to lose its acidity. You have exposure to it, and it grows in a dark, moist environment. That's actually what fungus absolutely loves. However, this is so interesting. This is so interesting because this is actually what I have seen clinically. Where do nail funguses typically grow? Is they usually will grow in the toe beds. And what I first think of when someone has some kind of nail fungus is actually the first thing that I see is I say, all right, well, what's going on with the nerve system and the vascular supply going on to that area? What's going on with the nerve system that's going on to that area? And what's interesting is that I will see many times problems with fungus in the nail beds, especially when it comes to men who have really bad spinal problems down at about L5 or L4, and that is actually where the nerves that travel down the sciatic nerve and innervates the actual skin in that area. So if you've ever known someone who had like disc swelling, they had a herniated disc, and they're like, yeah, like my toe went numb, or the outside of my foot went numb. Well, specifically, if that's happening around L4 and L5, and you're having some issues with disc degeneration or disc pressure, and that's affecting the nerve system, many times what you will see is it will actually affect the vascular supply that allows enough blood supply to go into the area. And if you can't get a blood supply into the area, you're not going to be able to get the immune system into that area to be able to handle some kind of fungal infection. So this is really interesting because I see it in a lot of people who have chronic spinal conditions down in the lower part of the back. But then ultimately too is you got to look at what on earth is going on with the immune system. So if we happen to actually do some kind of immune system panel, like a complete blood count with a differential and looking at CD4, CD8 cells, CD19, all of those different types of specialty immune system cells, a lot of times what you will see is you will see that their immune system is really suffering. It's really suffering. So, this is why you don't see toenail fungus in an 8-year-old. This is why, but you will see it in people 50, 60, 70 years of age because their immune systems are taking a hit. And why are their immune systems taking a hit? It could be multiple different reasons. It could be blood sugar issues. It could be problems in the gastrointestinal system. It could be chronic stress. So all of those different things going on. And so this right here, toenail fungus, is not a cause. It's not like the fungus attacks you. It's a result of a poor immune system function and poor nerve system function. All right, guys, so the next one that we're going to go over is dark circles around the neck. Now, me being a chiropractor, I see this quite a bit. So if I have a person sitting up and we're doing arthrostim types adjustments or just the neck seated, and you look down, you pull the hair up, and you're seeing these dark purple type rings around the neck, one of the things that you also will notice is that skin is very dark, but to the touch, it's very smooth and it almost feels very velvety. So it almost feels like it's velvet, okay? So if someone has those dark circles around the neck, here's what it actually means. It means that you have way too much cortisol. You're probably insulin resistant. So who do you think I see this quite a bit? Is I see people who are type 2 diabetic. I also see this in people who have problems with cortisol. Okay, so if they have too much cortisol going on inside of the body, you'll see the changes actually take place in through the skin. So guys, if you look down, look at your spouse, say, let me check your neck, and you see that there is that discoloration where it's almost a dark purple and it's very like velvety to the touch, then I guarantee you they're having a problem with hyperinsulinemia, too much insulin. And why would someone have too much insulin? Because they don't hear insulin anymore. The body's got to keep pumping it out in order to get the cells to be able to respond, in order to be able to shuttle sugar into the cell to be able to use as a usable form of energy. Now, guys, when that happens, what also will happen is that cortisol will always be pumping out to try to increasing your blood sugar, because again, these people have very poor blood sugar control. And so what the body does in order to get the blood sugar back up is it releases cortisol, and then that cortisol will actually stimulate the release of stored sugar back into circulation or back into use. So if you get those dark again, those dark circles, those dark bands, and it feels very velvety, you have a blood sugar problem. Even if you go to the doctor and they say, yep, blood sugar is within a normal range, just remember is that the last thing to go when it comes to type 2 diabetes is literally the blood sugar. You have to actually go backwards and you have to check actually insulin. That is actually the one that you really need to check. You will see that elevated for years before you will actually see cortisol, or you'll see your blood sugar actually elevated as well, okay? Now, what about age spots, all right? What about age spots? So age spots, a lot of times where you'll see them is that you'll see them around here, you'll see them on the forehead, but you also will see them on the backs of the hands. And I know right now everyone's looking at the back of their hands and they're probably freaking out right now, but a lot of times what we called these in the past is we called these liver spots. They're not liver spots and they're not age spots, because you can take two people, they're both 60 years of age. Mary doesn't have age spots, but Joan, she's got age spots everywhere. And is it a genetic? It's not genetic, all right? What it means is it means that the skin is actually breaking down. Now, what we actually call this is we call this ages, okay? Not aging, but ages, okay? These are going to be different than freckles. These are going to be larger and they're going to be brown. They're called advanced glycation end stages. Advanced glycation end stages. Basically what this is when sugar attaches to a protein, okay? When sugar attaches to a protein. And so what you'll see is it will affect anything with collagen, okay? So anything with collagen. So I want you to think about that. Anything with collagen. Well, gosh, that's my skin, isn't it? But you know where else that you have a high amount of collagen is actually going to be in your arterial system, okay? Into the arteries. The arteries have a high amount of collagen. The arterial walls, the venous walls, all have a high amount of collagen. So would it be safe to assume that if you have those age spots, then you probably have some arterial damage taking place? Oh, so you start getting some arterial damage and now the body needs to heal it, and then you're going to see your cholesterol levels go up? Because remember, cholesterol is produced based on need. It's not going up for no reason whatsoever. So what actually causes the ages? And that is actually having chronically elevated blood sugar. So what's your blood sugar? This is why, guys, I don't like taking blood sugar, fasting blood sugar, because it really means nothing. All it is just a snapshot of where you're at right then and there. So you could be fasting for 6 hours, and then right before you get your blood work, you may get a phone call saying, hey, your dog just got ran over and it's dead, and now you're going to spike in a stress response, which is going to raise your blood sugar. So then you take your blood test, and then you're seeing that your blood sugar is elevated, not because you might be necessarily diabetic, but because you might be actually stressed. So a better test to actually look at is going to be what's known as A1C, which A1C is going to be basically what your blood sugar average is over 90 days. What's interesting is what they look at in A1Cs, they're looking at basically the glycation of your red blood cells. So high blood sugar damages the soft tissues, which, yes, includes your red blood cells. And so they're looking at red blood cell damage, and that's how they're measuring your blood sugar. So it just so happens that your skin is also soft tissue, and you will see that as a reflection of having blood sugar issues. Now, Dr. Nate, what causes the high blood sugar? Well, yeah, chronic, having too many processed carbs, having too many processed grains, having a high stress type environment. So all of those are going to play a role in that, guys. So, the thing that we're actually looking at is, that we're looking at as far as like, what are some things that you can do? Hopefully you guys are realizing, well, gosh, for a lot of these, I just need to actually stop eating so much doggone sugar and stop being so stressed all the time. All right. Now, the last one I want to go over is what we would call the granny hump. All right. So it's the granny hump. I talk to this all the time, and it absolutely scares the bejesus out of women. What's so interesting, guys, and this also includes men, is I want you guys to think how much of what you do when it comes to your health And when it comes to your health routine, how much of it is inspired by how you look? Let me say that again. How much of your health routine is really inspired by how you look and not necessarily what you can do and accomplish with your health? See, one of the biggest things that we have to transition people over to is if you do healthy habits, yes, you will look better, but it's much bigger than that. It's much deeper than that, okay? So we have a skincare routine, right? We want to put something, use a jaw exerciser because we have the granny posture and we don't like our loose jowls. You know, we do some back exercises because we don't like the big hump on our back. We run ourselves ragged as far as exercise because we're scared to death of putting on weight. So think about it. Think about it right now. How much do I do as far as my health routine? Does it really have to do with just trying to look better? Okay. So what about this granny hump? Because when I tell a woman, I'm like, yeah, listen, you're getting the granny hump. I could tell them in the same sentence, you have cancer, you also have a big hump on your back, and you look like grandma, and they will cry because they look like grandma and not because they have cancer, all right? So what causes what would be called this granny hump? So what do I mean by it? Well, this is when you are seeing the head go forward and you're seeing a fatty deposition right at the very top part of the back or the very bottom part of the neck. So what on earth causes this? Well, there can be two big reasons why this is happening. So let me give you one of them, okay? So one of them is actually having too much cortisol, okay? So having too much cortisol, and again, there could be a lot of different reasons why there is too much cortisol taking place. But remember, cortisol can actually signal where there is going to be fat deposition, which is why when you see people who might have something like a pituitary tumor that then is actually secreting stimulating hormone for release of cortisol, which can happen, then you actually will see they'll get what they call a buffalo hump. You'll see a very rounded type face, and you'll actually will see a lot of fat deposition around the waist, okay? So you might also see a lot of the women after pregnancy call it tiger stripes. So you're seeing that scar tissue and the actual damage to the soft tissue, which is why you see the stretch marks and things like that. Now, the other reason why it could happen is it can actually be something that's actually mechanical. So it's called forward head posture. So I want you to think of this, all right? So let's talk about this. Forward head posture, it is from a physical standpoint, it is one of the most damaging things to a person's neurology, to their nerve system especially. And in fact, I can actually show you research articles that actually shows that as the head goes forward, like what you see, ears over the shoulders, ears going forward in front of the shoulders, ears going way forward in front of the shoulders, is that this has actually been linked to an increase in atherosclerosis. It's been linked to an increase in lung disease, okay? I want you to think about it. If your head is going really far forward in this position, there is actually a ton of mechanical stress on the lungs in order to just even get enough oxygen in. But think about this. If that head is going forward, and we call that, yes, the granny posture, but when that head goes forward, you will take a 12-pound head, and as it continues to go forward, that head can be 42 pounds or even more. And the reason why is that's the amount of force that's being placed on this lever arm, which is actually at the very lowest part of the neck. So I would say this, what would you rather hold? I said you got to hold this bowling ball for the next hour. You can hold it here, right over your elbow, or you can take it and you can hold it out in front of you. And I guarantee if it's 12 pounds, you may last about 10 or 20 seconds, okay? So you have to hold the body upright over gravity. So when that head starts to weigh 42 pounds, and if I was trying to hold a bowling ball out in front of me, well, if I did that every single day, pretty soon I would have a deltoid that would look like a bodybuilder's. It would look like a big giant boulder and that's an adaptation. The body says, hey, if you're going to hold this bowling ball way out, I better start building some muscle to be able to handle that stress, okay? So when the spine is actually, the head is so far and forward, then there's going to be a reaction right there in order to be able to handle that stress better. And so what you'll actually will do is you will get a lay down of a lot of fatty tissue in order to be able to handle that stress, which is why you'll start seeing swelling, why you'll start seeing some fatty tissue, and why actually these bones will deteriorate very quickly, because what it will do is it will try to stabilize that area by laying down more bone and by actually thickening the ligaments. Now, what you'll run into then is you'll just run into so much nerve damage, because those bones will actually start to grow into the nerve system, which is why it will absolutely destroy your hands, your elbows. It will destroy your shoulders. You won't be able to move them the way that you're supposed to. But remember, you also have neurological involvement that goes into things like thyroid, heart, goes into the lungs as well, which is why, guys, when you look at everything, nothing is just physical, nothing is just chemical, and nothing is just mental. It's all of them together. And this is why in the Wellness Way, we are experts when it comes to be able to look at physical, mental, chemical, and be able to look at all those different things and start helping people start to regain their health, so that the more stressors you can start to reduce, the more permission you're giving your body to say it's now okay to be able to heal. So this right here, when you look at someone, it is very hard for a lot of things to recover if that head is so far out in front and constantly causing a stressor neurologically that's also affecting chemically, because this can even affect the motility of the gastrointestinal system. Probably one of the biggest things that then it affects is actually mobility. As the head goes forward, you will very quickly start to lose mobility in the body. You will also see the lower back start to change. You will also see like your ab strength start to change. And this is why the more you see people with a forward head, you'll notice that they are very heavy walkers, because they have very poor core muscle control. Okay? So you have to start working on being able to get the head back over the body to take the stress off of the actual nerve system. Now, can people say, yeah, it's starting to go down? So, you know, a lot of times, because remember, we do things with our health based on how we look, and we literally can have a woman's thyroid go back to normal, but she says, thank you, doctor. Thank you, Dr. Nate. I no longer have the hump on my back, so I look so much better. Now, one of the things that adaptations that will take place as well, as the head goes forward, you actually will see atrophy of all of the tiny postural muscles that are underneath, sitting around the spine as well. And when those postural muscles, when they're changed, they can start to atrophy. So as they start to atrophy, guys, this is where you start to see the saggy jowls and things like that. So yes, you can even improve a person's appearance by what actually happens by changing actually their posture, bringing their head back over the body. It's interesting, guys, because I can actually, without even x-raying, I will know what their x-ray will look like just by the appearance of their face, because even the position of the head and neck will change the appearance and actually the bone structure and the musculature even around the face. So guys, hopefully this helped you out. If you enjoyed this, make sure that you share this with other people, okay? So we love doing this on Saturday, just to be able to give you guys a new perspective, a fresh perspective. Because remember, if it's not working out, doing the same things over and over is the definition of insanity. You have to start coming from things from a different perspective. And the perspective that we come from is called the Swiss watch principle, because all of these organ systems are working in synchrony with one another. And you have a problem with the nerve system, it affects all other organ systems as well. You have a problem with the digestive system, guys. This is why it will infect the skin. This is why it affects the immune system. This is why it affects the respiratory system. Hello, asthma. This is why it affects the whole entire system. You have a problem with the endocrine system. We just showed you why you'll have a problem with the integrity, with your skin, why you'll have a problem maybe putting on muscle, why you'll have a problem with the digestive system, why you'll have a problem with all of those different things. And you got to understand, the body is wonderful. The body is magnificent. We are not God. There is one God. We are not God, which is why it always baffles me that we think that we can manipulate the body, that we know more than how God created the body. And this is why many things that we do in healthcare have devastating side effects, because we're playing God and we're not working with creation. We're trying to manipulate it instead. So hopefully, guys, that makes a lot of sense. And if you're watching right now and you're in the Yorkville area, the Chicagoland area, we're going to be doing our next event, which is our approach to inflammation, guys. This is incredible. Inflammation is incredible. And the reason why is because really, in order for your body to heal, one of the things that you have to do is you have to start finding the sources and lowering the sources of inflammation. You actually have to do that first, even before the body can start to heal. So what is linked to inflammation? Well, what about weight loss? What about cancer, infertility, thyroid disease, arthritis, type 2 diabetes, autoimmune conditions, hormone conditions? Guys, there all is an inflammatory link behind it. If you guys watched their testimonial video that we had with Carrie, Carrie has actually lost, between her and her husband, 120 pounds. They've lost a whole human being between the two of them. But the thing is weight loss was never our goal. And in fact, we never even mentioned weight loss. But remember, weight loss actually happened as a result of lowering inflammation and as a result of changing habits and changing lifestyles. And if you're from the Yorkville area or surrounding areas, please make sure you just go to the top of our page. You'll see a link pinned to the top that you can go and actually register via Eventbrite for that event. It's going to be on Tuesday, week from Tuesday. I believe it's June 29th, I think. And during that, we'll be talking about inflammation. We'll also have some special prizes for our guests, and we'll also be doing giveaways, and we'll also have a special offer for you on that night. So, hey guys, next Saturday, I haven't decided what I want to talk about, but I am actually thinking about talking about the 4 movements that you need to master as you age, okay? So people ask me all the time, people say, well, hey, you're an exercise expert. I wouldn't call myself an expert, but I do know, I've studied a lot. We have trained thousands of people, but we look at exercise from a completely different perspective. I don't exercise to punish my body or to run off the Christmas cookies. I actually exercise in order to be able to move better and for me to be able to do things better in everyday life. So that means if you're going to exercise, get off the elliptical, get off the treadmill, quit punishing yourself with hours of exercise. And if you're going to exercise, all you need to do is create a hormonal shift, number 1, and number 2, you have to be able to move better. So I think I'll go over the top 4 movements that you should be incorporating in your training almost every single day. And if you can't do it, how you start to work on being able to do that step by step by step. Because remember, the worst thing that can happen is for you to be of sound mind, but of decrepit physical body, and to be stuck and rotting in a nursing home, unable to move, get off of the toilet and get out of bed, but yet you still have the sound mind to know how miserable you are. So you need a sound mind, you need a sound body as well, and you need to be training in order to be able to keep moving at a high level, well into your 70s, your 80s, and yes, even into your 90s. So you need to start training for that right now. So join me next week at 10:30. We'll put a post out that will definitely confirm if we're going to do that or not. But guys, make sure you share this video. I love you. I appreciate all of you. I hope you have a great weekend. And if you're a dad out there, let me just say this, Dad. Thanks for being a dad, and don't give up. The impact that you are making on your kids is immeasurable. And I will tell you, Dad, I said, you're doing better than you think you are, but keep striving to do better. Our world needs more dads. Our world needs more men willing to be men and are willing to be great fathers to their kids and great husbands to their wives. So keep getting better. That includes in your relationships with your kids, with your wife, but that also includes your health. Don't neglect your health, because your kids, they want you around for a very long time. And so start living for them. Remember, we always will say this. Say, I would die for my kids. And I promise you, you probably would. I would do the same. But are you willing to live for them right now? And what does living for them means? It means taking care of yourself so that you can be around for them for as long as possible. You'd be willing to die for your kids, but are you willing to live for them? Happy Father's Day to all the men out there. I hope you make it a great day. I hope you get lots of socks, lots of ties. Actually, I hope you get something that you actually want. So guys, be well. We'll talk to you guys later on in the week.